Anything you need to know. Who, what, when, where, why, how.
You're watching Telebel Top. It's a pleasure this morning to have with us Dr. David Turcotte, research professor in the Department of Economics, director, principal investigator, the New England Consortium, researcher program director in the Center for Community Research and Engagement, the University of UMass Lowell. Welcome to the show, Doctor.
Thank you. Good morning.
Good morning. The first question I'm going to ask you, the U.S. retained its position of being the world's largest economy since 1871. The U.S. economy shrank by 9.5% from April to June. How that will affect the life of the American citizens?
Well, I mean, it's already affecting the lives, as you know, in many ways. First of all, certain sectors, certain types of occupations and individuals are being impacted disproportionately. It's not being shared across the board. So certainly, when the economy shrinks, that means people have less money to spend, which reinforces, the shrinkage and the depression of economic activity. But, as I mentioned, it hasn't been, distributed equally. Last week, 1.4 million new claims, were filed. It's a 19th straight week of more than 1 million new unemployment claims. So people continue to become unemployed. So that could expand in certain sectors, but in other sectors there may be hiring. So obviously the sectors that are being impacted the most are like gas stations, retail operations, healthcare, which may seem strange. Well, healthcare, why? We're in a pandemic. Why wouldn't there be more demand and more need for jobs in healthcare? But I'll discuss that maybe in a little bit. Restaurant, bars, hotels, hospitality industries been impacted dramatically. Travel, airlines. Some sectors have, saw improvements. Sales of recreational goods and vehicles have gone up because people are traveling long distances less, so they're, doing their recreational activity locally more than maybe in the past. Some auto sales have been going up. People with a lot of money have been buying bigger homes now because the interest rates are low. So there's been, increased activity on the upper end of the housing market. High tech is, done well because we're doing Zoom interview, right? So, so people are communicating more using technology. So there's been, increases in those areas.
Sectors you've been naming in restaurants, gas station, and we know the unemployment, the $600 benefits will be expired today. So
Yeah.
Do you think a second stimulus will help the economy, revive the economy?
Well, certainly, but again, it all depends on where the stimulus is focused.
Mm-hmm.
Is it going to be focused on extending the additional $600 of unemployment benefits? Is it going to be at $200 like the Republicans would prefer? Is it going to be for, how long of a period of time? So, I mean, it really depends on where the money is going to be targeted to, which sectors and which individuals within the economy. And, whereas Massachusetts right now, has the highest unemployment in the United States, in excess of 17%, but I don't have the specific figures, but my assumption would be that within the Black community, the immigrant communities, based on, historical data, that the unemployment rate would be higher, continue to be higher in those sectors. So, how the impact is not equitable. Generally, minorities, individuals of color, new immigrants are impacted disproportionately. I'm based on what I know, I'm assuming that, in many of these sectors that I mentioned, individuals within the Haitian community would be working in those sectors, right?
Yes, we do have a lot.
Yeah, so they've obviously been impacted, you know, in very extreme ways compared to someone like me. You know, I'm working from my home. You know, I've been working remotely since the end of March. I am fortunate that, you know, I have the ability to do that, but there are many people that can only work and earn a paycheck if they're physically in a location. But if that location is closed or the number of positions have been downsized, then they don't have a job. They don't have an income.
Okay. The GDP also shrank at an annual
Right.
2.9%, according to the Bureau of Economic Analysis. And what should we expect to see at the end of the year in terms of investment? Are people going to invest more? The people who have more money, and the people who have money, what they're going to do?
Right. Well, as I mentioned, people with money are buying bigger homes
Yes.
because they can get, you know, let's say whatever, you know, I have a lot of money, I have a big mansion, mortgage payments. And, but now I can buy even a bigger mansion and still pay with a new mortgage and still pay $20,000 a month because, you know, my interest rates are 2% lower than they were. You know?
Okay. Continue. You were saying something. Go ahead.
Yeah. So, I mean, I forgot the first part of the question. I kind of answered the second part.
Okay, the first part was like, what would be happening at the end of the year? Because
I expect that the, you know, we're not going to get an annualized 32%, you know, drop in the GDP. It's going to be lower, you know, but it's still going to be bad.
Okay.
But I suspect that, you know, the areas of the United States where, like in Massachusetts, you know, we've been opening up our economy. So the numbers for July and August are going to be much better than they were in April and May. So this quarter in Massachusetts, assuming we don't go, you know, back to where we were, you know, should be much better. But then other areas of the country, as you know, like in the South and now the Midwest seems to be a new area where, you know, we're seeing spikes in coronavirus cases and hospitalizations. You know, that would be a situation where their economy has probably been doing better now, but it may be doing worse over the next couple of months because they're going to need to maybe close down restaurants or reduce the capacity in restaurants. It's going to impact, you know, the tourism industry, the hospitality industry. There may be other, you know, wider lockdowns, you know, closing gyms, closing hair salons, you know, barber shops, things like that. So I think it's going to, you know, depending on the region and depending on the extent of the virus, that, you know, but I suspect that, you know, it's going to be bad, but it's not going to be as bad as 32%. You know?
Okay, excellent.
Right.
Let's look at a scenario right now, and a lot of states they've been opening so fast, and we're still dealing with COVID-19.
Yes.
Do you think by opening, even they go by phases, phase 1, phase 2, phase 3, we still have people getting affected? The same thing happened in Massachusetts. We have Brockton, we have Lynn, and Revere. People are getting infected by COVID-19.
Yeah, that's another.
Gonna go back the same way and again?
Well, that's the same, you know, issue as, you know, with the impact of the economy. It's the same, unfortunately, with the impact of COVID-19. It's disproportionately, you know, impacted communities of color more than, you know, the white community. So basically, you know, within the black community, you know, it's 3 times more likely you're going to, you know, based on the numbers, that you're going to get infected. And, you know, the rate of fatalities, you know, due to COVID-19 are 2 to 3 times higher also than the white community. Now, there may be various factors affecting that. One is that, as we've been talking about, I've been working safely from home, right? But if you're, you know, on the front line, if you're working in grocery stores and restaurants, if you're working in construction, if you're working in, you know, maintenance and repair, those essential services where a lot of workers of color are concentrated, then you have higher risk.
Yeah.
So, and then you also have the extended family. It's more common where you have, 3 generations living together in the communities of color are more common in immigrant communities, as you know. So the risk is greater within the family because you may have younger members who are working, and then they're coming home and they may they have mild symptoms, but then they infect an older member or someone that is at higher risk because of another health issue, and then that person gets extremely sick, gets hospitalized, may die. So it's really the situation of there's been a lot of focus on systemic racism,
Mm-hmm.
as you know, and these are just all manifestations of the systemic racism. It may not be delivered by individuals, that this happens, but the system, the way the system is functions and designs and structured and distributed within the country leads to these inequitable outcomes.
Should they retake the American system because there's a lot of inequality in the country we call the champion of democracy?
Yeah, I mean, it's, there's a lot of, as you know, social movements and protests today. One of the icons of the civil rights movement of the United States, funeral was yesterday, John Lewis.
Mm-hmm.
And, if you know that history, he was arrested many times, he was beaten many times, but there was a struggle, it was a nonviolent struggle, but, on his side, but obviously there was a violent response in many cases response to, efforts to change the system and to, improve democracy and expand voting rights and, address in these inequities. Now, fortunately, it's not the 1960s. People can go out in the streets generally and they aren't going to be beaten automatically in large numbers or have dogs sicked on them. But what we do know, obviously, that there's been, sectors of police forces that have, disproportionately targeted communities of color. It has resulted into, deaths. That's why the Black Lives Movement was born, as you know. So, I mean, there's no one simple, easy fix. This is a complicated problem, and to restructure a whole system and to make, comprehensive changes to the whole system is not easy. But, the first step is recognizing that we need to do something, right? This is a problem. There's inequities in the system. There's been improvements, certainly, in many areas and advances, but still got a long ways to go. And identifying, what changes can be made and how those changes should be made to bring about more equity, within the United States and to enhance, the functioning of the democracy within the United States.
Price of living are getting higher. The cost for healthcare is getting higher. So people are worried, especially the people who do the essential work and the immigrant community. What advice would you give them? Because they live paycheck by paycheck to survive in this crisis.
Yeah, this is the challenge because obviously, from a public health perspective, locking people down and having everyone stay home is is an effective way of limiting virus transmission. But, I'm fortunate, I can, work from home remotely. It's not going to affect my paycheck.
Mm-hmm.
But if I'm, a dishwasher and I can't go to my job and wash my, the dishes because the restaurant's closed, then I don't have a paycheck, right, this week. So on the short term, I think, the best thing to do is to obviously protect your health, right? Because if you get coronavirus and you're in the hospital, even if you're like me, you have the ability to work remotely, you're not going to be able to work and you could end up dying as a result. So I think I sent you some information about one of my projects that,
Yes.
that is providing training to essential workers and others, who are going to be entering the workforce. It's extremely important to learn, how to protect yourself from the virus, what your rights are, as a worker, to ensure your health and safety, and the techniques that'll work, and to not listen to misinformation out there about, as you taking things that will prevent you from getting the virus, it won't, or, I heard, my wife is from Mexico actually, and she communicating with a cousin, and her cousin told her that, the city where she lives, the problem has increased now. It's kind of an epicenter in Mexico. But she did a lot of research, and she knows that by inhaling chloroxide, that's going to prevent her from getting the virus.
Mm-hmm.
There is no scientific evidence that that protects you. And, that's like inhaling Clorox, which is going to have negative impacts on your life. So you got to make sure you're not getting misinformation on the internet, that you're really learning from professionals who are basing what they're teaching on science. In the the free training program that I emailed you about does that. We have very experienced trainers who know the science and are giving solid, accurate information that people can follow to protect themselves. So that's on the health side. On the kind of more on the economic side, I mean, obviously you want to, if you feel like you're in an essential work situation that is not very stable, because you're subjective to very fluctuations due to COVID-19 and others, obviously, if there's an opportunity for you to be looking for other, jobs or occupational opportunities where there may be more growth and more security, then you want to be looking for those opportunities.
We know, and government people have been complaining the way they handle the crisis, especially the president, and by putting pressure on local government and to open the state, open school. And right now we're in recession. So what's the next 3 months will be for us? Because we don't know. We questioning ourselves. Should we put money in 401k? Should we invest in the stock market? What should we do?
Well, investing in the stock market, I wouldn't consider myself an investment advisor, but I would say you probably, don't want to put all your money into the stock market right now, because it's likely to be volatile, especially with the election coming up. So you may want to, diversity is always what they recommend. So, but you may want to, if you're going to invest in like a mutual fund or something like that, you want to invest in mutual funds that don't put more than 50% of the money into stock portfolio. So I would say, anywhere from 30 to 50% to be more conservative. Should be in the stock market right now, and the other is in more safer bonds and other kinds of investments. That's what I hear as advice right now. I mean, obviously, as we mentioned, certain sectors are doing better than others. So obviously, airline company stock has gone down in value. Hotel stock. So, but then some of the high tech stocks have done well. Their values have gone up. So it really, depends on, which industry and what is the distribution of stock within certain industries that you might have an investment in.
Thank you, Dr. David Turcotte, for taking your time to be with us today. It's a pleasure. We hope to see you again for more information. We're going to talk about more of the economy. Have a blessing day and stay healthy.
Okay, thank you.
Anything you need to know. Who, what, when, where, why, how.